Hi, my name is Anne Marie Keppel. I am a trained nurse assistant, a death doula, and the author of Death Nesting. I'm going to give you a crash course on how to care for an individual who is at home either bedridden or too ill to move themselves easily. So a lot of people are going through this right now, having never actually done this kind of care before, so hopefully this will be helpful. The first thing that you'll want to do is make sure the flow of the room is a space that you can move easily in and get all of the things that you will need into the room so you don't have to keep coming and going. So that means having a laundry basket in place, having a trash can, having pillows for propping. If you have access to a bedpan, have that in the room. And also extra sheets, towels, cleaning supplies. If you happen to have masks and gloves, those are helpful as well. So the first thing I'd like to talk about is a draw sheet. This is simply a twin sheet that is folded in half the long way and then folded in half again. This goes under the trunk of the body, which helps make it easier to move the individual either further up in the bed, further down in the bed, or for rolling them so you can change the sheets or change their undergarments. This helps save your back because there's actually a lot of physical work that has to be done when you're caring for somebody who's bedridden. I'm going to show you first how to roll the individual. So this draw sheet under the trunk of their body, we grab onto either end, and I'm going to very carefully move the individual, roll them onto their side, and then from here I can hold them steady, smooth the sheet back out again so there are no wrinkles, and from here I can either begin to change the undergarment by taking down this half, or I could change the sheets or the draw sheet by rolling it underneath. So I'm going to show you how to change and remove the draw sheet, just so that this is shortcutted. So I'm going to accordion the sheet on the back side. I'm going to roll the person back again, use the sheet to roll them. And what I've done is I've actually pulled the entire sheet out from underneath them without having to actually pick the person up. And you would do the same thing. So if I were changing the undergarment, I'd then be able to take down this side and remove it, change it. So it's a lot of rolling back and forth. And then you can do the exact same thing when you're changing, putting a fresh sheet in. You accordion it, get it snug under the person so that when you roll them back again and roll them onto their side, you easily can pull the sheet through, smooth it out so there are no wrinkles, and move them back again. Another thing I'd like to show you is about pillow propping. So when somebody is bedridden, they can end up with bed sores, or perhaps you just want to help make them more comfortable while they're laying in bed. So a pillow under the head is helpful. Then also you can put a pillow if they're on their back. You can put it under one arm, and then you would do the other arm as well. And you can lift their knees and tuck a pillow under their knees. And with a towel or another pillow, you can elevate the heels so that they're not resting on the bed at all. A lot of pressure falls on the heels, so you kind of want them in mid-air. So all of this is done with a straight back. You're trying to spare yourself as much physical activity as possible, physical strain. So if this individual were to go on their side, I would do the same thing. I grab the ends of the draw sheet, roll them onto their side, hold them there, smooth the sheet back out again. You put a pillow behind them to keep them from rolling back, a pillow in front of them to rest their arm on, and a pillow between their knees. And you can ask them, does that feel comfortable? Okay, so this bed is not ideal. I'm going to remove this one from behind your back so you can roll back this way. This bed is not ideal. This is a double bed. Ideally, you would have a hospital bed, but a lot of people are probably not going to have a hospital bed in their home at this time. So I'd like to make note that transfers to the bathroom can be really difficult. Maybe your loved one does not have a catheter, maybe you don't have a bedpan, maybe you don't have a commode. You could actually make a makeshift toilet out of a 5-gallon bucket and a toilet seat if you needed to. But I'm going to show you how to do a transfer for somebody to help make it both safe and to not hurt your back and to not hurt the individual. So first, you're going to do this by squatting and using a straight back. You're going to try to assist the individual up to a sitting position, and then they'll swing their legs off the side of the bed. And then I'm going to make sure that where I'm going to be putting them, either in a chair or on the commode, whatever it happens to be, is as close as possible. So there's as little movement as possible. So I'm going to hug her and ask her to help me stand and pivot and then back up so that the back of the legs are touching the chair or the commode, and then they sit down. So that is a safe way to do a transfer. You would do the same thing in reverse. If you were getting back into the bed again, use your bent legs and a straight back to help lift the person. Hopefully they can help you. Make small steps to scoot and pivot back up till their legs hit the bed and back down again. And then they can either lay down onto their side or they can put their legs back up again, and then they could lay down. And just briefly, I would mention that when you're caring for somebody who has something contagious, you of course would want to be wearing a mask. You'd want the individual to be wearing a mask, and you'd want to be wearing gloves also. All of these things are in shortage right now, so you may not have them available to you. But if you were to have gloves available, people are using anything they can right now. You'd wash your hands thoroughly first, and then when you have the gloves on, the proper way to remove them so you're not getting any bacteria or germs, viruses anywhere, is to pinch the center of one glove and turn it inside out. It's going to go directly into the garbage, which I wouldn't have picked up with my bare hand. And then by tucking 2 fingers under the wrist here, you turn it inside out, and that is how you throw away your gloves. Good luck caring for your loved ones. Remember that you're not alone. There are a lot of people going through this now, and I hope that you get the resources and kind of care and assistance that you're able to receive.